Debate once today when the Democratic leader chose to offer this motion, knowing that, of course, it's not serious. What he's talking about here, just after having rejected a very common sense proposal, which is a one-week extension for the unemployment insurance, by the way, at $600, which is exactly what the Democrats say they want. They want to keep it at $600, even though, as we know from numerous studies, that means that for many people, in fact, 68% of the people in unemployment insurance, based on the University of Chicago study, for 68% of those folks, they're making more on unemployment insurance than they can make at work. And I think all of us here in this chamber want to be sure that folks are taken care of. And in fact, we just voted on legislation to provide the ability to be able to debate this very issue and other issues. But to say that people should be making substantially more for not working rather than working is something that I think even a lot of my Democratic colleagues do not find acceptable. But instead, Majority Leader is once again offering the HEROES Act, as he has done before. Recall, this is the House-passed legislation that was passed actually a while ago during different times, but it's $3.5 trillion. That's what the CBO says, $3.5 trillion. That makes it, of course, the most expensive piece of legislation ever passed by either body, any time in our history, by far. By the way, it has a number of provisions that have nothing to do with COVID-19. So here we are in the middle of this crisis. In many places, it's getting worse, not better. We do need to act, but we need to be sure we're acting in an effective, targeted way and not putting things out there, $3.5 trillion bill, including many things that have nothing to do with COVID-19. It has immigration policy changes there. We can debate those separately. Immigration policy issues are very contentious and are tough things for us to resolve in any context, but certainly we shouldn't put it in the COVID-19 bill. It has unprecedented mandates on the states that says to the states, you've got to do the elections the way Congress wants to do it. You've got to do it mail-in ballots the way we're saying you have to do it, and you have to use the kind of IDs that we say you have to use. This has always been in the province of the states. And again, a lot of my Democratic colleagues agree it should continue to be in the province of the states to make those kinds of detailed decisions on elections. It doubles the amount of money in the HEROES Act that goes to the states as compared to what even the National Governors Association is asking for. So $3.5 trillion, it begins to add up when you do things like that. You give twice as much to the states as the states are even asking for. And of course, one of my favorite, and I know, again, the senator from New York feels strongly about this from a tax policy point of view, but it includes in the COVID-19 bill a very expensive change in tax policy that actually is a huge tax break for wealthy individuals. That's repealing the SALT changes that were made. Over 50% of the benefit of this goes to the top 1%. That's based on the Tax Policy Center. Based on our own Joint Committee on Taxation, a nonpartisan group here in Congress, what they're trying to get through in their legislation, the HEROES Act, 40% of that benefit or more, according to the Joint Committee on Taxation, goes to those with income over $1 million. What's that doing in the COVID-19 bill? The Democratic leader talked about the need for more money for testing. I couldn't agree with him more. And by the way, the proposal that was presented by Senator McConnell earlier this week has a lot more money for testing. It also has more money for antiviral medications, for vaccines, for ensuring that workplaces can be safe. It has the same amount of money, maybe even a little bit more, the senator from Tennessee can tell us, for our schools, to be able to reopen our schools safely. So there's a lot of common ground here. I think we can find it. I really do. I know that today has not been an example of that. We're even rejecting here a moment ago, a 7-day simple extension of $600 per week. But when I look at it, I see the schools' money being practically identical. I see the tax provisions that we have to help encourage people to go back to work, encourage companies and nonprofits to be able to put measures in place to make the workplace safe, like plexiglass shields or hand sanitizer or PPE. These are all things we can agree with, even on the issue of unemployment insurance. And I've talked to many of my colleagues on both sides of the aisle about this. I think there's a way we can get there. I think Democrats realize that $600 per week does create that disincentive because it is on average 134% of what people were making in the private sector. So we can come up with a way to deal with that. One is a return to work bonus, which is an idea that has, I think, a lot of bipartisan appeal. So let's put aside these games. Let's put aside these extreme positions. Let's figure out how we can come together. This evening was not a good example of that, having rejected the 7-day limit, the 7-day extension of the $600 per week on unemployment insurance. But I think now we have this opportunity with the legislation that was passed earlier today to begin to have that debate. We can have the debate on unemployment insurance. We can have it on a whole range of issues, how we deal with schools, how we deal with the health care crisis that we have, the underlying crisis. We can deal with all these issues in a way that enables us to find common ground to create real solutions for the people we represent as we face this unprecedented pandemic. With that, Mr. President, I object.
Mr. President.